My name is Sue Gray. I work at Children's in Minneapolis in Minnesota. I work on the heart unit where I take care of kids that have had heart surgery. And this is the first national kind of conference that I've been able to come to, and I'm really excited to be here.
Now, what made you decide to come to DC? You kind of have a unique story. Tell me a little bit about that.
I was diagnosed with breast cancer initially 12 years ago, and 5 years ago I was diagnosed with it metastasized, so I now have a stage 4 cancer, and it's a terminal, incurable type of cancer. And so my friends all encouraged me to come on this to this conference, just to first of all to be able to experience it, and to be able to see what's going on, and to see if my story can help in any way help any other people.
Now, is it true that you've continued to work even though you have cancer right now? Can you tell us why that is?
My husband is self-employed. He's a self-employed cabinet maker, and with the economy the way it is, his business has really not been doing very well for the past few years. So he's been trying to get a job, applying for any job that he would be remotely possibly able to get, in the hopes that he could get health care, because I carry all the health care for my whole family right now. And so I need to keep working no matter what, as long as I possibly can, just to keep health insurance for our family.
What's that like? I mean, what's it like? I mean, you have stage 4 cancer. That's got to be just devastating news. And how do you go to work every day and take care of kids and do your job?
I think I need to, first of all. I don't have a choice. I mean, I feel like I have to keep going, and I have to keep working because I need to do it for my family. And most of the time, it depends on the chemotherapy that I'm on. Right now I'm feeling pretty good with the chemo, and it seems to be working and holding the cancer kind of at bay. But I get tired. I mean, I used to work 12-hour shifts and 3 a week, and I'm down to working 2 8-hour shifts a week. And I get tired. I get really tired. I have problems with my hands and my feet, but I know I have to do it.
Can you tell me a little bit about the role? You know, you said you're proud to be part of MNA, proud to be part of the union. Tell me a little bit why that is. Has that really helped you with benefits at work and having to deal with all the health stuff and knowing that you have a contract kind of in place that'll cover you for that?
I have always been very much a pro-union person. I feel like our union has really gotten us a lot of things and protected us along the way. And now that I'm on disability part-time, and with working part-time, I really depend on my union to be able to protect me as time goes on. So it's become more and more important. With our contract, we're able to work just a .4, which is 2 days a week, and still maintain health care benefits, which is amazing to me. I mean, I'm very lucky to have that, to be able to keep working as much as I do, and to be able to keep health and care, keeping the insurance for my family.
Now, can you tell me a little bit about the families you see and the patients you see? Are they kind of in similar situations to you as far as feeling the crunch with the economy and not having the health coverage they need? And
I think a lot of the parents that I talk to are feeling definitely the crunch. We see kids that are having heart surgery, and so some of these kids are kids that have a very serious heart defect, and so like they'll need stage surgeries where they have multiple heart surgeries over the first few years of their life. So a lot of the parents, one of them will need to quit their job to be able to take care of those kids, and so therefore now they're down to one-income families where they weren't before. And some of them, in particular, one family I just recently was talking to, she was concerned because one of the medicines that her child needed was $600 a month, and she said, I don't know how they're going to keep paying for that. And so I worry. I think sometimes parents come in, or their kids will come in, and they're considered non-compliant, or they're not following what the doctor said. But what I worry is it that they're not following it, or they can't follow it because they don't have enough money to be able to afford those medicines. And I think it's hard. It's hard to admit that. I mean, even I feel that way. Like, we've used up all our savings. I've been in and out of the hospital and sick off and on for the last 12 years, but it's embarrassing to say you don't have any savings, you don't have any way to, take care of those things when you should be able to.
So with the cancer? I mean, what's the prognosis? Did they give you a timetable at all?
I
or?
never want to know a timetable. I've never asked a timetable. I do know stage 4, a lot of the things I will read, they'll say average life expectancy is like 2.5 to 3 years, but I've already been stage 4 for 5 years. But I keep, as long as what happens is I'm on a chemotherapy, and as long as it keeps working, I'm okay. Once that chemotherapy stops working, then what we do is we switch to a different chemo. And until I run out of chemotherapies, I'm okay. And so I've just learned to enjoy life, and we don't take life for granted anymore. I mean, I think it's definitely changed my lifestyle. And the kids are all aware of it, and I think, like, my youngest one was 5 when I was first diagnosed, so he's kind of just grown up knowing that his mom has had cancer a lot of his life, and that's just the way it is.
Last question: as a nurse, you're always used to taking care of others, so who takes care of you?
I am very lucky in a lot of ways, because I feel like I have a great family to support me. I have lots of friends. I feel very lucky and very blessed in a lot of ways for that reason.